Hi. This slides is regarding nursing management. It will explains about theory and design of health organization. We will explore on nursing organization and job description. These are the objectives for these session. At the end of this lecture, student will be able to define organization, list elements of organization, discuss importance of organization, mention of characteristics of organization chart, discuss pattern of organization, define job description, list purposes of job description, mention of uses of job description, organizing. In the organizing phase, relationships are defined, procedures are outlined, equipment is readied, and tasks are assigned. Organizing also involves establishing a formal structure that provides the best possible coordination or use of resources to accomplish unit objectives. This is the elements of organizing. First, organizational structure. Second, developing job descriptions. Third, staffing. And fourth is scheduling. Organizational structure. Organizational structure refers to the way in which a group is formed, its lines of communication, and its means for channeling authority and making decisions. It clarifies the formal relationships of individuals in the various positions within the organization. Why organizational structure are so important? First, it enables members what their responsibilities. Second, it frees the manager and the individual workers to concentrate on their respective roles and responsibilities. Third, it coordinates all organization activities so there is minimal duplication of effort or conflict. Fourth is to avoid overlapping of function because it pinpoints responsibilities. And lastly, it shows to whom and for whom they are responsible. In organizational relationship, it divides into two: formal relations and informal relations. In formal relations, the formal structure, through departmentalization and work division, provides a framework for defining managerial authority, responsibility, and accountability. Whereby in informal relations, the informal structure is generally social, with blurred or shifting lines of authority and accountability. Organizational chart. Organizational chart is a line drawing that shows how the parts of an organization are linked. The organization chart establishes the following. First is formal lines of authority, refers to the official power to act. Second, responsibility refers to the duty or assignment. Thirdly is accountability, which refers to the moral responsibility. Authority is defined as the official power to act. It is power given by the organization to direct the work of others. A manager may have the authority to hire, fire, or discipline others. A responsibility is a duty or an assignment. It is the implementation of a job. For example, a responsibility common to many charge nurses is establishing the unit's daily patient care assignment. Accountability means that individuals agree to be morally responsible for the consequences of their actions. A nurse who reports a medication error is being accountable for the responsibilities inherent in the position. Here is the 5 major characteristics of an organizational chart: division of work, chain of command, type of work, span of control, unity of command, levels of management. Chain of command. It is a formal line of authority and communication within the organization, and the structure demonstrates who formally reports to whom within the organization. The vertical lines in the chart represent chain of command. Unity of command. The concept of unity of command is that each person on the organization chart has one manager or one boss. Span of control. Span of control means the number of individuals a person is responsible for managing. A wide span of control indicates that many people are reporting to a manager, and a narrow span of control indicates that only a few people are reporting to the manager. Patterns of organizational structure. Tall or centralized structure. Flat or decentralized structure. Tall or centralized structure. Bureaucracy. Decision-making and power are held by a few people within the top level. Each person who has some power and authority is responsible for only a few people. There are many layers of departments. Flat or decentralized structures. The decentralized structure is flat in nature, and organizational power is spread out throughout the structure. There are few layers in the reporting structure, and managers have a broad span of control. Flat or decentralized structure. The advantages of flat or decentralized structure is: 1. Communication patterns are simplified, problems tend to be addressed with ease and efficiency. 2. Employees have autonomy and increased job satisfaction within this type of structure. And the disadvantages of flat or decentralized structure is: 1. Supervisors spend less time with each worker. 2. Supervisors may lack expertise in the variety of operations and may end up making inappropriate decisions. Job descriptions refers to a written statement, found in policy manuals that describe the duties and functions of the various jobs within the organization, and it outline the scope of authority, responsibility, and accountability involved in each position. Job descriptions should provide the broad general guidelines under which the individual will function, and the basis for performance evaluation of the person working in that role. These are the contents of a job description. 1. Identifying data. 2. Job summary. 3. Qualification requirements. Job description is used for recruitment and selection of qualified personnel, to orient new employees to their jobs, for job placement, transfer or dismissal, as an aid in evaluating the performance of an employee, for budgetary purposes, for determining departmental functions and relationships to help define the organizational structure, to serve as channel of communication, for classifying levels of nursing functions according to skill levels required, to identify training needs, as basis for staffing. Management theory refers to behavioral theories explain aspects of management and leadership based on behaviors of managers or leaders and followers. Organizational theory provides a framework for understanding complex organizations. Helps to understand the management process. These are the management functions. 1. Planning. 2. Organizing. 3. Staffing. 4. Directing. Lastly, controlling. Management functions. Planning includes defining goals and objectives, developing policies and procedures, determining resource allocation, and developing evaluation methods. Management functions. Organizing includes identifying the management structure to accomplish work, determining communication processes, and coordinating people, time, and work. Management functions. Staffing includes those activities required to have qualified people accomplish work such as recruiting, hiring, training, scheduling and ongoing staff development. Management functions. Directing encourages employees to accomplish goals and objectives and involves communicating, delegating, motivating, and managing conflict. Management functions. Controlling analyzes results to evaluate accomplishments and includes evaluating employee performance, analyzing financial activities, and monitoring quality of care. These are the roles of the nurse manager: as a customer service provider, as a team builder, as a resource manager, as a decision maker and as a problem solver, and as a change agent. Roles of the nurse manager: as a customer service provider, by providing service or care to customers, patient or clients. Being a nurse must keep customer service first and foremost as the motivator of all plans and activities, because without customers, the organization will go out of business. Roles of the nurse manager: as a team builder, a team is a group of people organized to accomplish the necessary work of an organization. Teams have become important in the changing healthcare environment. Teams bring together a range of people with different knowledge, skills, and experiences to meet customer. Roles of the nurse manager. As a resource manager, resources include the personnel, time, and supplies needed to accomplish the goals of the organization. And nurse manager has the responsibility by effectively manage resources in providing safe, effective patient care in an economic manner. There are 3 types of budgets. 1. Personnel. Allocates funds for salaries, overtime, benefits, staff development and training, and employee turnover costs. 2. Operating budget. Allocates funds for daily expenses such as utilities, repairs, maintenance, and patient care supplies. And 3. Capital budget. Allocates funds for construction projects and/or long-life equipment such as cardiac monitors, defibrillators, and computer hardware. The capital budget items are generally more expensive than operating supplies. Roles of nurse manager as a decision maker and problem solver. These are the components of effective leadership and management in clinical patient care. The problem solving is focused on solving an immediate problem, and decision maker includes a decision-making step. Nursing process as a problem-solving process which includes the assessment, analysis and diagnosis, planning, implementation, and evaluation. It has been proven to be effective to manage the complex decisions. In assessment, the nurses should gather information about the situation, identify the problem, separate the symptoms, identify people and groups involved, identify cultural and environmental factors, and encourage input from involved parties. Doing analysis and diagnosis by analyze results of information gathered, identify, clarify, and prioritize the actual problem, and determine if intervention is appropriate. Planning by identify as many solutions as possible, elicit participation from people or groups affected, review options and consider safety, efficiency, costs, quality, and legal issues, consider positive and negative outcomes. Remain open-minded and flexible when considering options. Do the implementation. By communicate plans to everyone affected. Be sure plans, goals, and objectives are clearly identified. Maintain open, two-way communication with staff. Support and encourage compliance among all staff. Evaluate by identify evaluation criteria in the planning. Identify who is responsible for evaluation, what will be measured, and when it will take place. Maintain open communication with all involved. Was the decision successful? What might have made it better? The nurse as a change agent is responsible for guiding people through the change process and needs to develop an understanding about the nature of change and effective change strategies. Change should be implemented only for good reason. Change should always be planned and implemented gradually. Change should never be unexpected or abrupt. All people who may be affected by the change should be involved in planning for the change. The most important responsibility for the nurse in any leadership or management role is to create an environment of caring for staff members as well as for patients and families. Staff members who believe that their manager sincerely cares about them and the work they do are able to pass that feeling of caring on to their patients and other customers. According to McNeese-Smith 1997, caring for the staff members can be demonstrated through offering sincere positive recognition for both individuals and teams, praising and giving thanks for a job well done, spending time with staff members to reinforce positive work behaviors, meeting the staff members' personal needs whenever possible, such as accommodating scheduling needs for family events and being flexible in times of illness, providing guidance and support for professional and personal growth, maintaining a positive, confident attitude and a pleasant work environment. Leadership and management skills and behaviors. Hersey and Blanchard 1988 have identified that effective leadership and management requires skills in 3 major areas. First is technical skills, such as clinical expertise and nursing knowledge. Second, human skills, the ability and judgment to work with people in an effective leadership role. Third is conceptual skills. The ability to understand the complexities of the overall organization, and where one's own area of management fits into the overall organization. These table shows leader versus manager. Thank you.